Good morning, everyone, and welcome to today's presentation. Once again, Mark Nanzer, Executive Director for the Retired Employees of San Diego County. Thank you all for attending, and it's great to, well, I was going to say it's great to see everyone. That's what's on my script, but I see your names on the screen, and we appreciate that. Having the video off for presentations makes it a little less confusing in the Zoom world that we're living in right now, and folks being muted, we appreciate that as well. Before I introduce today's presenter, I'm going to go over just a few Zoom meeting logistics with everybody. Already have talked about the video and being off and you being muted, limiting background noise and distractions. And as we get into the presentation, what we found works well is if you have questions for our presenter today, Hazel Quinones from Aging and Independent Services at the County of San Diego, we found the best way is to not have questions during Hazel's presentation, but to use the chat function and write down on the below your at the bottom of the screen when you bring your mouse down below, a little bar pops up and there's a chat button. You just click on that. There's a drop down. You can say pick who you want to send the message to, and you just send it to Resdek. That's me. And then I keep all the questions. I hold on to them. I'm gonna just let somebody in real quick here. Another guest coming in. Just give me 1 second. All you do is click on Resdek, type your message in right below there, and I will gather those questions and ask them to Hazel after we're done with the presentation. Another great thing is for your friends and colleagues is what we do is we record these presentations and we hold on to them, and then we post them on the Resdek YouTube channel. And if you give me 1 second, I'm going to show you what that looks like. We found that it's a great way to archive our presentations and give the ability for folks to visit and watch the presentations if they have a conflict and can't attend the presentation live. So I'm going to share my screen here. I'm going to show you what our Resdek YouTube channel looks like. It's very cool. Nice little backdrop of San Diego County. We should put the Padres Stadium in there now that they're playing there again. Anyway, that's just a personal thing. And you can see the array of presentations we have. The one that's going to be currently going on, I'm sorry, that was the one we had last month, Good Mental Health is Ageless, that Hazel was great and did a presentation on as well. We have COVID-19 vaccinations, living well, ways to engage. These are all in a series of presentations that Aging and Independent Services has presented for our organization and our membership. You have other playlists down here that has Health and Human Services, different types of videos, National Institute on Retirement Security, great information about pensions and what's going on in the world of public pensions and just different information. Another one of our partners, My Senior Health Plan, you see down here, Virtual Resdek, a lot of presentations that we did last year, all available to you at a few clicks, and being able to check them out whenever you want. And once again, tell your friends about them too. Okay, so I'm excited to announce that today's presentation is the next in a series of virtual presentations by our partners at Health and Human Service Agency, Aging and Independent Services, that we will be hosting over the coming months. Stay tuned to upcoming network newsletters and email blasts for more information on our upcoming virtual presentations. We have monthly presentations going through October, and you can learn more about the upcoming ones, which are July and August, also presented by our friends at AIS, by just going to our website, or we send out email blasts as well. And it's also promoted in the hard copy of the network newsletter. And I want to really thank AIS staff for this great partnership and the opportunity to spread the word about the excellent programs and services that they offer. We're pleased to be hosting today's presentation, Medicines, Alcohol, and Tobacco, which provides awareness of medicines that do not mix well with other prescriptions, over-the-counter medications, herbal vitamin supplements, and alcohol. Hazel Quinones is an outreach and education staff member of the Health and Community Engagement Team at the County of San Diego Health and Human Services Agency, Aging and Independent Services. Hazel has her bachelor's degree in social work and communication studies, and she has her master's degree in social work. Hazel has worked with diverse populations, children and families, adults, and now working with older adults, persons with disabilities, and caregivers. Hazel has a passion for helping others through education and community involvement. She also enjoys caring for her family, hiking, and hopes to travel more. Hazel, oh, I'm sorry, I repeated it twice on my script. Anyway, so once again, she did a presentation last month. We've enjoyed this partnership with AIS, and without further ado, I'm going to turn it over to Hazel, and she's going to bring up her PowerPoint presentation, and we hope you all enjoy the presentation. Thanks so much.
Thank you so much, Mark, and I will share my screen. Okay. So thank you. Good morning, everyone. And thank you, Resdek, for having me as a presenter. So today I will be sharing about having a healthy outlook on life and touching on aging, medicine, alcohol, and tobacco, and smoking in general. So I'll be sharing about information and resources, and hopefully if you or someone needs help with any of these issues, then you know where to go to from this presentation, and we can kind of help you. So first, I'd like to share about Live Well San Diego, which is the county's vision for a region that is building better health, living safely, and thriving. It aligns the efforts of individuals and organizations and the government to help all San Diego County residents live well. So for more information about news, events, and how to become a Live Well San Diego partner, please visit the website livewellsd.org. The County of San Diego's Live Well vision came about when we noticed that there were 3 big health issues in San Diego County. There are 3 behaviors listed here: no physical activity, poor diet, and tobacco use, that we saw that were leading to 4 diseases: cancer, heart disease, stroke, type 2 diabetes, and lung disease, that result in about 50% of deaths in San Diego County. So this is why the Live Well San Diego vision was created, and we want to increase awareness on substance use and resources that can help you and your loved ones. So as you may know, Americans are living longer than ever before. This is good news. We're living longer, the older adult population is growing. However, we've seen a growing need for services as well: personal care, transportation, housing. We've seen a bigger need for safety equipment like grab bars, safety measures that need to be taken in the home, meals and food assistance. So it's estimated that out of every 5 adults age 60 or older misuses prescription drugs and or alcohol. Substance use disorders are a silent epidemic because they can go undiagnosed, or they can be undertreated or not treated at all. And this is a health problem that can affect someone's physical health and mental health. However, the good news is that it can be prevented and effectively treated. So as Mark read, my background is in social work. I'm not a medical professional, and the purpose of this presentation is to educate the community and spread awareness about substance use and to share resources that we have in San Diego County. The next few slides, I'll share some myths that people might have about substance use. So the first myth is that over-the-counter medicines and alcohol can be used safely together. And the truth is that it's never safe to drink alcohol while taking medication. So for both prescription medication and over-the-counter medicines, it can intensify the effects of alcohol. Alcohol can make you drowsy or lightheaded, and the combination of alcohol and medication can lead to falls or serious injuries, and this can be dangerous or even fatal. And also medications, including popular pain and cold remedies, contain more than one ingredient that can react with alcohol. So for example, some medications also contain alcohol, like cough syrup, laxatives, things like that. The second myth is that very few women suffer from alcoholism. And the reality is that many women may struggle with alcohol. So women may drink only in private, so people don't know. In society and some cultures, it's more acceptable for men to drink and less acceptable for women. So this might have been where this myth came from, but if a woman does have a problem with alcoholism, they might be more hesitant to share about it, but it just doesn't mean that women don't have the same struggles as men with alcoholism. And then the last myth is that, went a little bit too far. Treating substance abuse in older adults is a waste of time. And this is absolutely not true. We know that interventions and treatment is available for anyone at any age, and it's never too late to get help. So when it comes to medications, we just wanted to share some basic recommendations. And of course, if you have any specific questions or other questions that I might not be able to answer, definitely consult with your doctor or your pharmacist. But I just wanted to share some examples of how you can organize your medication. So just remember that, you know, if you do take medication and different types of medication, one way for you to keep track of everything is to have it maybe in a pill box or use a timer to be able to organize. You can also list your medications, vitamins, your health conditions on a vial of life, which is this device here on the left side. And this is a free tool that is available to anyone. You can call us at our call center listed here, 1-800-339-4661. This is our AIS call center, and you can request this vial of life where you can put all your information. And really the goal of this tool is for you to be able to put all your information, medical information on the piece of paper, and you insert it in this little device, and you stick it onto your fridge. It has a magnet, and you stick it on your fridge. And if there's any emergency that happens, emergency responders or your loved one can take it with you to the hospital, and it is readily available for when they need to treat you. It has all your medical information listed there. And then just some other basic recommendations. Check your expiration dates. If you're no longer using a medication, make sure to dispose of them properly. So there are some medications that you are able to flush. If you request a copy of this PowerPoint, this link here, or this button here is clickable, so it'll take you to the link to, this one has a list of locations where you can safely dispose of your medications. And then there's also a link there that shows which medicines you are able to flush and which ones you're not able to. And if you're not able to go to a drug take back drop off location, this little picture here shows how you can safely dispose of your medication properly at home. And that is just to mix your medicine with a substance like dirt or coffee grounds. And then you would put that mixture in a container, like a sealed plastic bag, and then you could put that in your trash can. And then just remember to, when you're disposing of your bottles, make sure that you are removing all your information, your personal information, like your name, because anyone can get a hold of that if you don't scratch that off properly. And then just some things that caregivers should know when they're caring for an older adult. They should keep track of what medications the older adult is taking and for what conditions. And just know, how often you're supposed to take your medication and whether the older adult is feels like that medication is helping or if there's any problems. If there are any problems, please consult with your doctor or pharmacist about your medications. And then some medication don'ts, things that you should not do. Don't trade your medications with another person. This is actually against the law. So, if you have a friend that might be experiencing the same things that you are, you're not really supposed to say like, oh, this is what my doctor gave me, try it. So that is against the law. Another thing you shouldn't do is don't break pills without consulting your doctor or pharmacist. If they say it's okay, then they usually will give you a pill cutter like that's pictured here. And that's very important just because some pills are not meant to be split. It could result in different dosages and that could be very dangerous. And then again, never mix alcohol and medication. You just never know what type of reactions might occur. And if a medicine is taken in a wrong dose, or maybe someone accidentally takes a medication that wasn't theirs, you could always call the poison helpline as a resource. Their phone number is here. And if you want more information, they also have a website that has a lot of good tips on, keeping your medication in a safe place, put it somewhere where, in one place where you're always going to go to it, especially if you have children in the house. But the poison helpline, they are available 24/7 and they have bilingual services as well. So now let's discuss how to look for signs that something might be wrong. So here's some signs of someone that might be misusing alcohol or medicine. You might see that person experiencing fatigue, drowsiness, especially during the day, heartburn, nausea, or bloating, slurred speech, blurred vision. A person might experience mobility problems. And, if they're falling, they're going to be getting bruises, or if they're bumping into things, that can cause bruising as well. Some other signs might be feeling like a memory loss, confusion, aggressive or abusive behavior could also be a sign. Frequent car accidents or DUIs. Blackouts and seizures could happen, and then suicidal thoughts and attempts as well could also be a sign of misusing alcohol or medication. And some physical effects. There's different ways that your body can react to misusing medication or alcohol. So in the brain, it can affect how your brain works, how your brain looks physically, mood changes, your judgment, behavior. With your heart, it can cause a stroke, high blood pressure, arrhythmias, liver inflammations, fibrosis. With your pancreas, it can produce toxic substances and leading to pancreatitis, and it can also prevent proper digestion. It could also cause cancer. It can weaken your immune system, and mental health issues can also occur: depression, anxiety, amnesia, again with the memory loss. If you or someone that you know is struggling with alcoholism, one tool that you can use is the SMASG screening tool. So this is something that you can do in the privacy of your own home. Again, this button here is clickable, so it will lead you to the screening test. And also it's available for Mark to email you. I did send him like the separate screening test. So if you would like to request it, you could also just Google SMASG and it'll pop up, and you can just take it from the internet. So it's 10 yes or no questions, and it'll tell you on the test how to score yourself. But this is something that, anyone could use if you feel like you're struggling with alcoholism. This is something that you can kind of keep yourself accountable, or if you feel like you are very concerned, you might want to share it with someone that you trust, a friend or a family member, or you can share it with your doctor too. So finding help may not be the easiest thing to do. People might experience barriers such as feeling shame or fear. Someone might be in denial, or a person might be having lack of resources or support to get through treatment. And so if you or someone that you know is struggling with misusing substances, I can just encourage you to kind of try to open up and share with a friend, share with someone that you trust. If you can, speak to your doctor about it. They can speak with you about different types of treatment, and other ways you can encourage someone that's struggling is they can also seek out self-help groups or support groups like Alcoholics Anonymous or Narcotics Anonymous, or different types of clubhouses. And then for someone who might be in denial, and for those types of situations, that might be when you would encourage family to seek professional intervention. So just know that with treatment and recovery, it could all look different for different people. Older adults may have a slower recovery process, and also just understand that relapse might happen, and that is part of the recovery process. So now onto smoking and tobacco. So smoking is the leading cause of preventable death in the US. I like to highlight this quote from Dr. Noman Edelman, and he said this on Health Day. I think this was like several years back. I don't remember the exact date, but he said that smoking is the most correctable cause of death and illness in the United States, and it's a health crisis that is amendable if we make an effort. So just some information from taken from a study back in 2000 and 2014. Smoking reduces the smoker's life expectancy by 10 to 25 years. And again, it's the single most preventable cause of death. And the most dangerous component of the cigarette is the smoke, and it contains the nitrogen oxide and carbon monoxide, which are harmful gases. And then there are also vapes or e-cigarettes. So these are the electronic devices that heat a solution or a liquid, and it produces the aerosol that is inhaled, similar to cigarette smoke. And you might know these by all these different names: mods, the vape pen, e-cigs. So there's all different types and all different names, and they all look different, but they are all the same kind of thing. And nicotine and other ingredients are not regulated by the FDA. And then these devices can be used for other substances as well. So it could be used for legal or illegal substances. And just so you know that there is a ban or restrictions on vaping. So these are the different areas of the world where it's restricted and banned completely. So you can kind of see there's a lot of countries where it's totally banned. In the US, it is restricted. For California, we became the second state to prohibit the sale of both flavored e-cigarettes and menthol cigarettes. So it is restricted in the US, and that just means that, you know, for vaping, they follow the same rules as smoking tobacco, where you have to follow the rules. If it's like a smoking-free environment, you're not allowed to smoke there. And then I just wanted to share these resources for getting help with quitting smoking. So the two big ones are the California Smokers Helpline. They can call this number. They also have some great resources on their website, nobuts.org. And they say that people who receive counseling are twice as likely to permanently stop smoking. And the California Smokers Helpline provides free counseling in several languages. They're open Monday through Saturday. And again, I've heard a lot of clients that tell me that, you know, it really helped them to be able to talk it out with somebody, even if it's just over the phone a couple times a week, or maybe even every day if they need it. And then another resource is smokefreesandiego.org. So this website shares local news, information on which places are smoke-free, and it also shares how to report a violation and resources on how to take action take action on how to become a smoke-free community. And then other options, if someone is interested in using medication or replacement therapy options, they're listed here: the patch, gum, nasal spray, or the medications like Zybin and Chantix. So these aids are to be used to stop nicotine dependency, but not really a long-term substitution. It's best to check for coverage with your medical provider or your insurance for all of these types of options. And then this is from the California Smokers Helpline. They give 10 tips on to help you when quitting. And so I'll just read them here. Find a reason to quit. You know, if you have a goal in mind that could help you keep your goal set, and make a plan. Call 1-800-NO-BUTS, get support. It really helps when you do have a support system or people in your life that will help you keep you accountable. Use a quitting aid. Make your home and car smoke-free. Set a quit date and then quit on the quit date. Picture yourself being a non-smoker. And then lastly, keep trying, because it's never too late to get help. And it really is just depends on the person. And the main thing is that you keep trying and don't give up on yourself. And the last slides are going to be just some photos and examples of preventative activities that we encourage folks to join to be able to keep a healthy outlook on life. These photos are from pre-COVID events, but I just wanted to share some photos from our past events. This is from a health fair we did in South Bay. These two photos here are from our intergenerational games, where older adults are paired with elementary school kids to do some fun sporting activities. And we've had intergenerational gardens in the past, and we still have our volunteers volunteering at the fire department and the police department. And physical health, anything you can do to keep your body active, whether it's just taking a walk outside, yoga, any type of movement that you can do, gardening, even dancing, can help with your physical health and your emotional health as well. And if you practice a faith, I know it's helpful to connect with that group of people who have the same faith and values as you. And socialization is very key. So as we are getting back to our normal lives, I hope that you are able to socialize safely with friends and family, whether that's sharing a meal with them, going out, taking a walk, or just visiting someone that you haven't seen in a while. And if you can't be there physically, there's always a phone call or FaceTime, anything that you can do to just kind of keep connected with your friends and family. And one more thing I wanted to share is our Vital Aging virtual conference that's coming up on June 24th. We usually have these big conferences. I think a couple years ago we had it at the San Diego Convention Center, but last year we weren't able to have one. This year it's going to be virtual, so you can enjoy our event from the comfort of your own home. We'll have speakers and opportunity drawings, and let's see. So if you do want to join us, please register at online, vitalagingsandiego.com, and you can just fill in your information. I believe it asks for your name, email address, so that you can join us online on June 24th, 8:30 to 2:30. And then these are just some references that we used to make this presentation. And this is my contact information. At the top, there's my phone number and email address, Hazel Quinones. Annabelle and Matthew, you've probably seen before and will be seeing again, doing presentations for Resdek, for the Resdek group. And yeah, we're always open to collaborating and sharing information and resources with the community. So please do not hesitate to contact us.
Thank you very much, Hazel. Great presentation. And we actually don't have any questions at this point, but I just wanted to follow up on a couple things Hazel just finished with. Check your email as well for more information and that flyer that Hazel just showed on the Vital Aging Conference, because the virtual Vital Aging Conference, because we're going to be promoting it via email to our email distribution list. If you are not on that email distribution list, you can reach out to us and let us know at via email at Resdek at, I'm sorry, Resdek, what is it again, Andrew? Resdek at resdek.net.
Resdek at resdek.net.
Thank you. That's my person behind the curtain who helps me so tremendously, Andrew. Andrew Steele, who is an outstanding Resdek staff, and then in addition, another thing you can get for us if you'd like, or get from us if you like, Resdek at resdek.net, is if you'd like to request the PowerPoint that Hazel went through. We have that as well. That way you could have your own personal copy of it and refer to some of the information that was shared on the slides. You know, we have a little bit of a smaller group. So if you like, I can go ahead and open it up if people want to unmute themselves or show their video again. If you have a question you'd like to ask Hazel, if not, we can end the meeting, end the presentation, and wish everybody well on the rest of their day and the rest of their week.